This resource has been developed by a team of academics with the help of a teaching and learning grant from Griffith University.
These video clips depict how to engage with families and how to do a family assessment.
Overall, we've got 4 different families who have faced health challenges, and we are depicting the nurse engaging the family in family assessment and understanding how the family are coping and working through those challenges.
Hello.
Hi.
My name's Vicky. I'm going to be your nurse today, and this must be James.
Yeah, this is James.
Oh, he looks very, very peaceful there, doesn't he? So, how have you both been since James has been in hospital?
Yeah, we're going okay, I guess. We're just a little bit tired. James has never really slept well.
Right.
Yeah, he's one of those babies that spits up all the time, and he never settles well on his cot, and they never get much sleep.
It's really tough when you can't get any sleep, isn't it? So, how have you coped with James not sleeping that well?
Well, we kind of take it in turns,
Yeah.
getting up in the night. But because I go to work, Mary usually gets up and
Yes.
deals with James when he's not settling in.
Okay.
You know, just so I can get some sleep, and then
Right.
well, she kind of sleeps during the day when James does, just to
Yeah.
get some rest.
Yeah.
Okay. So, you can get some sleep in the day. Is there anybody that can come to your house and be with him so that you can get some sleep during the day?
Yeah, Mum helps sometimes.
Okay.
But she's got a new partner now, and she's a bit busy.
Right.
But Bill is great with James, so once he gets home from work.
Yes.
During the day, it's just me and the babies.
Right, yeah, and it's great to be able to share the load, isn't it,
Yeah.
when you get home. So, do you mind if I ask you, how long have you both been together?
We were neighbours when we were younger.
Okay.
Well, Mary went away for a while, and we sort of just lost touch, I guess. Yeah, when we caught up again, we dated for about 18 months
Yeah,
before
yeah.
James came along.
Uh-huh.
We didn't plan James, but yeah, I'd say we definitely wouldn't have it any other way.
Absolutely.
I thought it would be easier than this though. It's been really hard looking after the baby, and now that James is a little bit sick, yeah, I've just been so worried about him.
Yeah. Look, well done for bringing him in, and it's not at all unusual for babies to become irritable with feeding, and these are all things that we can look at during your hospitalisation with us and hopefully find out why he's being this way.
That's good to know. It's good to know that other parents have this sort of same problem.
Yes, it's quite normal. Mary, have you had any checkups with the child health nurse with James since you've had him?
No, I didn't bother with it.
Okay.
Once I got out of hospital, I thought I'd be fine.
Yeah.
And to be honest, all the other mums were a lot older than me.
Right,
And I
okay.
didn't like the way they were looking at me when I was in the clinic.
Oh, that's too bad. Did you have any antenatal care? Did you go to any of the antenatal classes with
Yeah,
James?
well, basically, when we went, we were always the youngest parents there, and we just felt really
Right.
judged.
Yes, yeah.
You know, so Mary hated the antenatal classes, but I
Okay.
made her go just
Yeah.
because we didn't know anything about babies.
Yeah, look, that's great. I'm glad that you went, and it's a real shame that you felt like that. One thing that we could do, Mary, if you like, is to have the child health nurse actually come and visit you at home. And I also need to see with your GP, do you have a GP? Because we also need to look at vaccinations as well.
Yeah, I guess a nurse could come and visit us, but our flat is a little bit of a dump, really. But our local doctor's really good, so I guess if I could take James there for his vaccinations,
Yes,
that would
you
be
certainly
much
could.
better.
Yeah, look, that's great. Just getting back to your supports, do you have any family members or friends that have babies or young children that might be able to support you?
No. Most of my friends are working, and Bill doesn't really talk to his parents anymore. It's just the two of us, really.
Okay.
Yeah, we don't really have any support, and I've
Right.
had a bit of trouble filling out the Centrelink forms. They're just really confusing.
Yes, those forms can be really confusing, but I think it's really likely that you can get some help from Centrelink, so it's important that we do fill them in. I'll tell you what I can do. We have a social worker on staff, Carlotta, and she's here today. If you like, I can ask her to come in and meet with you probably this afternoon, and she can help you fill in those forms and help you a little bit further. Would you like me to do that for you?
Yeah.
That'd be
Yeah,
great.
that'd be
Okay,
awesome.
fantastic. That's not a problem at all. I'll go and give her a ring now and see what we can organise, and I'll be back in just a moment and let you know how things went.
Thank you.
Back in a moment. Hi Mary, hi Bill.
Hi.
Told you I'd come back. I've just got some really good news. I've spoken to the social worker. She's able to come and see you this afternoon. Does that suit you both? Are you going to be here this
Yeah,
afternoon?
That sounds great. We
Okay.
just didn't want to bother anyone.
Yeah.
Even my mum was saying that we should probably be able to do things by ourselves, and yeah.
Well, yeah, I mean, your mum could be of some help. You know, she's okay sometimes, but not really always. It'd be nice if she did help, you know. I think we're just doing the best thing we can, though.
Yeah, look, from what I can see, you're doing a fantastic job. Just looking at you now, Bill, you're so peaceful in your arms there. You look so bright and a lot healthier than when he first came in, and I think you're both doing a really good job.
Yeah, well, he does enjoy sleeping in my arms, you know. He seems pretty good here. You know, we spend a lot of time doing this kind of thing, you know, just cuddling and watching TV as a family, I guess.
Yeah, and I think it's really great to have that family time together. Can I ask you, Mary, are you planning to get involved in any mothers groups or play groups, something like that, to get some more support?
No, not really. It just seems like all the other mums are so much older than me.
Right, okay.
Yeah, Mary went once. She came home in tears. You know, I said not to go again because I just don't want to see her upset like that.
No, I understand. That's really tough. There are some groups in the community, mothers groups, play groups, that are actually aimed at younger parents, if that's something that you would be interested in. Okay, I can get you more information about that. Tell me, what other activities do you do together as a family?
Well, we like to spend our evenings together, and like Bill said, we like to take James for walks on the weekend.
Lovely.
And yeah, is that sort of what you mean?
I do, but I wonder also with your mum whether those are activities that you could also involve her in.
Maybe, but I can ask her. She's really great with James though when she comes over. It's just, I haven't asked around since last time when she said that I should be coping. I just felt like she was criticising me.
Yeah. I think it's probably time to have that conversation with her again, because from what you're both saying, she could be a really great support for you both. So perhaps there are some activities, you know, as a family that she might also like to get involved in. So I would encourage you to perhaps have that conversation with her again and see if there are some shared activities you can do that actually involve your mum as well. What do you think?
Yeah, I guess.
Okay.
Hi, I'm Carlotta. I'm the social worker. So Mary,
Yeah.
Bill,
Good.
hi, how are you?
Yeah, good.
And this is little James. He's having a sleep. I won't wake him up. So listen, I was asked to come and speak to you both today by your nurse, just to see how you're going. And apparently you're having a little bit of confusion with filling out Centrelink forms.
Yeah.
Okay.
We've just been struggling with those forms a little bit, and we just need some help while we're in this period while James is so young, because I can't go back to work and I just really need some help, I reckon.
Yeah.
Okay. Now I can certainly help you with that. Now you also mentioned to the nurse that you're caring for James by yourselves. Is that right?
Yeah, well, we're doing okay. James cries sometimes, and I don't always know what to do. And since he's been a bit sick and in hospital, it's just been a bit scary, and just not what I expected.
Yeah, and that's totally understandable. So where are you both, or all three of you I should say, are living at the moment?
We have a little flat. It's not far from here, and it's really small and it's old, and we have some people staying sometimes. But you know, you do the best you can with what you've got. But there's people coming and going at all hours sometimes, and I know that it's not the best place for James.
Okay. And you're also a little bit worried about the child health nurse visiting as well, is that right?
Yeah, but I think we'll be okay.
Yeah, we understand you guys are trying to help, but sometimes we just feel like we don't fit in.
Yeah. Okay. All right. Look, it's definitely, you know, something that happens sometimes, especially with first-time parents as well. But what I can do as a social worker is, one, help you out with the Centrelink forms, so I can organise the correct forms that you guys need, and I can even help you fill those out if you like.
Yeah, that'd be
Yeah.
great.
All right. And another thing I can help you with is public housing. So I do have a lot of contacts in the field as well. So if you would like me to organise something there, I might be able to arrange somewhere a little bit better for you to live.
That'd be great.
Great, all right, sounds like a plan. So leave the Centrelink forms with me. I will get onto that this afternoon. And is it okay if I pop back tomorrow morning and I'll help you fill them out?
Yeah,
Wonderful.
amazing.
Okay, great. Well, it was lovely to meet you, and I'll see you in the morning.
Thank you.
Thank you.
Thank you.
See you later.
Bye.